Poor or failing health, weakened immunity, chronic fatigue, and many other health issues are often the result of nutrient deficiencies. Now, addressing these deficiencies is one of the many things that makes naturopathic primary care so effective. As the body's health decreases, however, so too does its ability to effectively absorb and transport the nutrients it needs in order to heal or to function at its highest level. This decreased ability is even further hindered under periods of higher stress, as we age, and under increasing toxic load in cases of decreased GI absorption secondary to prior antibiotic therapy. This is even more magnified. It's why we will often see an infection become a secondary infection, then become a tertiary infection, and suddenly the patient's been sick for weeks, even months. The body is no longer efficiently receiving the nutrients it needs to support its immune system. Now, intravenous therapies allow us to bypass digestion altogether and deliver the therapeutic dose of nutrients required directly to the bloodstream. The high intravenous load can then create a concentration gradient that is able to support the cells, tissues, and organ systems directly, allowing the body to kickstart its own innate healing mechanisms. Even in very healthy patients, increasing vitamins or minerals will only marginally increase serum concentrations. Take vitamin C, for example. Even at high oral doses, the highest observed serum or blood concentration that we can see is about 9.3 milligrams per deciliter. Now contrast that to IV vitamin C, where we can see elevations as high as 80 milligrams per deciliter. That's why you can use IV vitamin C to treat viral infections, certain bacterial infections, and why it's even being used as a very effective adjunct in cancer care. What we see in many chronic conditions is the body is stuck in a pattern. Depression is a good example of this. It can take weeks, even months, for most antidepressants to work. In contrast, if we can support the neurochemistry intravenously with therapeutic doses of both B vitamins and amino acids, we can often see a dramatic shift in both serotonin and dopamine pathways. Similarly, in cases of anxiety, migraine, headaches, concussions, addiction recovery, and even neurodegenerative change, the ability to help and support the neurochemical architecture of the brain with nutrients is virtually endless. Whether the aim is to boost immunity, improve energy, address a chronic health condition, or improve your general level of health and wellness, I'm confident that we'll be able to customize the right IV formula for you. If you'd like to learn